Thanks, Maggie. Thanks for Talis for hosting us. As Maggie said, my name is Lovas. I'm the design director at Healthcare Human Factors. We are a healthcare-specific design and human factors testing consultancy. So we're actually embedded in the healthcare system. We're located in Toronto General Hospital, a couple floors above the ER. So we're in UHN, but we act as kind of an external consultant to a lot of med tech companies internationally, and then also startups around GTA. We also do some procurement for, we're involved in the procurement process at UHN. We also have our hands in some patient safety initiatives in the hospital. And then we also have some internal products that we're working on, mostly in chronic disease management. So we're kind of spread pretty across the entire healthcare spectrum. So I'm going to start my talk with a quote from the title of a really provocative article that came out in the New York Times a few months ago, written by a physician out of Mass General Hospital. And his claim was that hospital design is making us sicker. And he made a lot of good points around how the physical design of an actual hospital is influencing and helping, not helping, but hurting patients, working on causing falls, leading to infections. And his point was really around the physical design of the place hurt patients. And so I think that there's some truth there, but I think it goes a little bit further. I think the systems and the services that we design in healthcare aren't actually designed very well. I think oftentimes what happens in the ER, in the ICU, in the hospital, or in healthcare in general is really left up to an ad hoc process, and it just kind of happens. And people are trying their best, but it's not designed from a cohesive service level or a system level. And I think that's, there's a huge gap here, and there's tons of entrepreneurs in the audience, and I think this is a massive opportunity that you guys can look at. There's obvious reasons that this is the case, that I think we should be moving towards a more designed system or designed healthcare service. And one is that patients and practitioners are, demanding it. We all live with smartphones and great user experience day to day, and now once you, as a physician or as a nurse, you walk into the hospital and you're working with technology that's 30 years old, or feels like it's 30 years old, or you're a patient and you're working with technology or software or systems that feel super old. It's why is this happening? There's so much investment, there's so much time and energy put into the healthcare system. Why aren't we getting the best user experience? And so a lot of health technologies I find are product focused, specifically on the patient side, which makes a lot of sense. But I think if you're following the news, you'll notice that Jawbone has recently closed up. Great, product design, one of the best industrial designers in the world, but they couldn't make a go of it. And I think part of that was because they were just on the patient side. It wasn't a full service. So I'm arguing that we need to create products and services that integrate not only on the patient side, but also on the clinical side, and kind of a third layer, all the supporting structures beneath. And to do that is challenging. But there's this framework that we're using in our practice that it's called service design. It exists elsewhere, and we use it a lot of times when we're consulting and helping companies grow their products and services. And it's really about taking a kind of a holistic view of the entire service that you're offering. So a little definition: service design is the end-to-end research, planning, design of people, infrastructure, communication materials in order to improve the quality and interactions between healthcare providers and their patients. So super wordy, but really it's talking about dealing with all of the touch points across an entire patient journey, and looking at all of the different interactions and really designing them to make a cohesive experience for the patient and the provider. So you may be asking how, like, this sounds super daunting. I've got an app that I'm trying to get in front of patients. This sounds super daunting to take into consideration an entire patient journey, and think about how it engages with the clinicians. So I'm going to go through a few little tips on how you can use service design to apply to your own work. So what we do a lot is what's called ethnography, or basically, as we were talking about before, it's like fly on the wall. We observe what happens in clinic. It's qualitative research. It's pretty. It's not super sexy. You're watching what's happening from an outsider's perspective, but it's really powerful. You gain lots of insights on what's happening with the patients, but also with the clinicians and the support people. And so we mix that with quantitative research as well, but really we start with this. We start with the observation, the blind observer. And then another kind of tool that we use that you can all employ is mapping visually all of the touch points of your service. So what that really looks like is on the x-axis you've got time, and so you're going across the entire patient journey. So you're talking about starting from when the patient kind of becomes a patient until they kind of graduate from your service. And then on the y-axis, you're looking at all of the different layers of your service. So again, at the top, you're talking about the patient journey, and you're mapping out every interaction that they have with your service, whether it's with the physical, like a sign or a physical touch point, or a digital touch point, like most of you have, or a lot of people have apps, or pamphlets, referral materials, a web interface. All of those things get mapped onto this blueprint. And then you go down the layers into the clinical, the kind of first interaction, the front stage interaction. So when patients are interacting with the clinicians face to face, that's on the next layer. And then at the bottom, there's all this stuff that the patient never sees, which is super important and is often forgotten. So the person in the back who's like scanning and faxing paper charts, sending it to the PCPs, those people and their work is vitally important to the entire system. And so bringing all of this work into one kind of map, and then bringing all the stakeholders into a room to kind of hash out what exists today, or what ideating on what the future state could be, using a map like this, and there's lots of different versions of this, but using something like this allows everyone to get onto the same page and speak the same language. And it's a super powerful tool. It might look simple or it might look complex, but it's really approachable once you just try it out. And then the third point that I'll repeat over and over again is just kind of basic design principles: is prototype, test, and iterate. And so this is with a kind of a service design lens. We're talking about not only again, we're not talking just about digital touch points, but we're talking about physical and face-to-face interactions. So much of healthcare is delivered face-to-face. That's not going to change tomorrow. It may change, that might disappear at some point, but we're still engaging face-to-face a lot with our healthcare providers. And so mapping out what that interaction looks like when when the provider prescribes an app or a technology, mapping that out, understanding what the tone is, what the key points are, and prototyping that, play acting it, and iterating it until you kind of get it right is really important. And the same thing goes with the standard UI UX, physical industrial design, physical prototypes, and even onboarding slips or paper-based designs. And then the last point is just like in data or standard product design, your product is never kind of static, or it shouldn't be static. It's always a living, growing, evolving thing. And similarly, a service that you're providing should be growing and evolving. And so, after you launch, your service into the field, it's obviously super important to measure and respond to how things are evolving in real time. So this is where the data science comes in, and you can evolve based on your metrics. And that's all I've got. Thanks.
Better turn the mic on. Any questions?
Thanks, Mike. So, based on your exposure, why do you think it is that healthcare medical devices or healthcare essentially products that practitioners use are a few years behind in terms of UI and UX?
I think there's a lot of reasons. I think other people have talked about it. I think change is hard. I think adoption takes a long time. If you're a maxed out practitioner, you're working full time, the last thing you want, you're in a groove and you understand how your technology or your services work. The last thing that you want to do is bring on a new piece of technology, spend hours learning it, figuring out what it replaces, what it doesn't, how it interacts with other pieces of technology.
So what I'm confused about is that I'm in healthcare,
Sure.
and that user does the same thing for their home computers, for their phones. They get an upgrade.
Right.
They're okay to do that over there.
Right.
In their practice, it's more difficult to sort of get them to adopt new technologies.
Yeah. Well, I guess when you're at home by yourself, you have to take care of yourself and maybe your family. Whereas if you've got a whole clinic or a ward to deal with, it's a little bit more challenging. But to that point, I would say that the success that we see in terms of the kind of radical innovation in healthcare, I think it often comes with the leader of the clinic, whether it's the medical director, kind of champions the innovation and drives it into practice. That often works.
I think also, even though now I'm in technology, I didn't have tech in my household growing up, and there were late adopters in personal technology as well. It's just tech has become a part of pretty much every other industry except for health, and now it's just, I think we're just seeing the same as what happens in every other industry. It takes some time. You get early adopters, and then you get everybody else on board, and then late adopters. Although somebody yesterday at TechTO was arguing that education is slower than healthcare. Any other questions?
Sure.
Just with regards to, I guess, designing, obviously that's a great time. So I think that. But with regards to how you would design a system being a hospital versus what I think was up there, which is a design for maybe an ER, do you or have you guys found in that providing or doing system design for, say, an ER and then an adjacent clinic, does that then start making things better over time, or does it then become, okay, I've designed for both of these, and then at the very end of it, now I gotta redesign everything to put it all together, so you could dismantle the hospital and take out all the
Right.
stuff, right?
Yeah, so I guess I haven't personally been involved in doing two sites and then trying to stitch them together in close proximity. But we are going through a process right now of designing, so we're launching a program where it's already launched in one clinic, and then somewhere else in GTA there's another clinic. It's a program for multiple chronic conditions, and so we're trying to stitch together these multiple chronic conditions, and we're right in the middle of doing the stitching part, and it's incredibly complicated. Because these are siloed practices that have traditionally never talked to each other, any commonalities would go to the family doctor, and that's where they would share information. And so we're building the infrastructure to allow for that communication, but there's a massive, like to the earlier point, there's a massive kind of change in how the people work and how they communicate with other specialists. And so I can't give you a great answer right now, but we're working on it. Yeah, maybe not.
Any last questions?
I'll have one quick point. We are hiring human factors engineers and communication designers if anyone's looking.
Thank you.